Hello, my name's Diana. I'm going to talk to you about Vibrio, which is a bacteria. Um, so, what is Vibrio? Vibrio is a gram-negative bacteria, meaning once the gram stain is performed, it turns this bacteria pink, so the cell wall is dissolved. And typically, gram-negative bacteria are pathogenic. This one is. Um, This bacteria lives in warm waters like coastal sea waters or any type of brackish water. They like the salt that's in there. There are many types of species of Vibrio. Each one can have its own type of illness or symptoms. So there's a wide variety of kinds of Vibrio that you could get. You can also get cholera from Vibrio. There are two groups that cause cholera. And over here you can see, here's a gram stain. It's not the greatest, but you can see how these are a little pinkish. They're typically rod shaped and have one flagella. I have a better picture on the next couple slides. Now, how can you get Vibrio? You can get Vibrio from eating raw or uncooked shellfish that come from a place where Vibrio is or lives. So mostly raw oysters. Raw oysters are a big thing that you can get Vibrio from. So if you get oysters at a restaurant, you want to make sure that you get them cooked because they can have Vibrio and give you a gnarly disease. You can get these also from exposure of an open wound in the seawater or the brackish water, an open wound or a sore. It can get in there and do some pretty nasty stuff. It's not typically passed from person to person, meaning that if your friend has it and you're around them or you touch it, you're not gonna get it unless it's like ingested or gets into an open wound. So you don't have to really worry about that. It's not really contagious in like the air or stuff like that. It uses water. Um, so what symptoms are there of Vibrio? Well, there's some severe symptoms, and then there's also non-severe or not really dangerous symptoms. So the not really dangerous symptoms you don't really have to worry about are like a stomach ache or diarrhea. Those are just things you gotta let go on. But if it gets worse, of course, go to the doctor. You want to get that checked out. Um, but those are the considered not dangerous type of Vibrio. You have a mild type case. But if you do have an open wound exposed to this bacteria, it can get red and swollen. And then once it's in there, it can enter your blood and cause all types of things like a fever, some chills, or big old blisters where the sore was, which that's not fun. They look pretty gross. I have a picture on the next slide or so. So when you're exposed, the day you're exposed, you have 1 to 3 days of symptoms to arise. So it's not really that long. You just don't want to get it anyway, but you can get sick after 1 to 3 days of exposure. Now, who can get this more seriously? So if you have a liver disease or cancer, HIV, diabetes, or if you have a weak immune system, these are the types of people who will get more seriously ill than, say, a normal person who has a working immune system, doesn't have anything else to fight off. Then you don't have to really worry about it that much. But if you have a weak immune system, you're pretty more susceptible for getting sick. So here's some pictures of the blisters that you can get. Here's one that's not so bad. I mean, it's bad, but it's not as bad as these other ones. Looks like it got in their foot. That's not good either. Here's one that looks like it got into the finger. It has some pretty gross blisters in there. Looks like they're at the hospital, so hopefully they're getting that checked out. And then here's one they have on their hand. That one looks pretty severe. So if you have something like that, you definitely want to go to the doctor so they can get that fixed or something. So how are you diagnosed with Vibrio? So you have to go to the doctor, and they have to take a sample of stool or a sample from the wound itself, or even your blood, and they look at that and they stain it under a microscope to see what you have. And if you have this type of bacteria, long rod shaped with a flagella, and you have all these symptoms, they conclude it with Vibrio. So that's how they do that. And for treatment options of Vibrio, there's not really any Vibrio treatment. They say for mild cases that they don't give you any antibiotics or anything. They just tell you to drink lots of water because you can get dehydration from the diarrhea if you do have that. But they just send you home and tell you to drink lots of water so you don't get too dehydrated. And if you have a severe case, like those blisters before, they'll give you antibiotics, but these antibiotics don't really decrease the severity or the duration of this type of bacteria. They just kind of use it to, I guess, make them feel better about it, try and get you to calm down a little bit, I guess. The antibiotics don't really do anything. They just use it in severe cases. So, now how do you prevent Vibrio? To prevent Vibrio, you want to make sure you eat cooked shellfish. You don't want to eat any raw oysters from any restaurant because they could be contaminated with Vibrio, and you don't want that. Make sure you cook it thoroughly. Cook it thoroughly. That's the main thing. If you want to eat shellfish, it needs to be fully cooked. And if you are dealing with raw shellfish, you want to wash your hands immediately after, so you don't have to worry about having the Vibrio bacteria on your hands. Use mild soap or antibacterial soap and nice warm water to scrub your hands really well and get that off your hands, because you don't need that in your system. You also don't want to swim in brackish or salt water if you have an open wound, because that's the main type of thing they like to get into. Like I said, they can get into it and get in your blood and give you some fevers and chills, and some pretty big blisters. So that's not what you want. Now, if you have a weakened immune system, meaning if you have stuff like a liver disease, cancer, HIV, or diabetes, or any other thing that would make your immune system weak, you want to make sure you cover yourself up if you're around raw shellfish, or if you're in seawater or brackish water. You can wear protective clothes, you can wear protective shoes when you have an open wound. That's the main thing. An open wound, you want to protect from this type of bacteria in water. You can also use gloves when you're around any type of shellfish. You don't want to get that in your system. So these are my references. I used the CDC, and I also used this place called mothertobaby.org. They had a lot of stuff from Vibrio, and they used CDC. I appreciate you guys watching my video, and have a good day.